So today we're gonna be doing Botox on this beautiful girl. So we're gonna be doing Botox for the forehead, around the eyes, between the eyes, and we're gonna be putting Botox also in the chin to be able to relax the chin because the muscles of her chin are hyperactive. So as you can see, they move when she talks. So starting with the forehead, we have the glabella. So the glabella, we have two muscles. We have the corrugators and we have the procerus. Can you frown? Frown, frown, frown. So you actually feel the muscle, and these two muscles, they mainly form the two vertical lines, the 11 lines from the 11 number, so which is this line and this other line. So to inject those, I'm using today Botox. I'm gonna ask you to frown again. So you always have to feel the muscle. You have to be 1 centimeter above the orbital ridge, and then you go perpendicular into the muscle and you put 4 units of Botox. That's 4 units of Botox, and then you have to go almost 1 centimeter to the side. Make sure you're 1 centimeter above the orbital ridge, and then you put 4 more units. When injecting the procerus, so mainly you do an X, which is between the medial canthus and the eyebrow. So it's and then you go perpendicular, and you also inject 4 units. So that's basically it. It's really quick. And then we're gonna do the other side. The other side, I'm gonna ask her to frown please, and then relax. So I'm using a 32 gauge needle, so it shouldn't be painful. All right. So within half an hour, all this is gonna go down. So this is gonna go down.
Okay.
Alright, now we're gonna do the forehead. So for the forehead, usually I ask the patients to lift the eyebrows up so we can see all these lines. So when you put your, when you decide on putting your, deciding on the spots where you're gonna inject the Botox. So first, open your eyes, please. So look straight. So this is the mid-papillary line. You go all the way up, and you ask her to lift her eyebrows up. Lift your eyebrows, and then you put 2 units. You inject 2 units over here. Do the same thing. Look straight. So this is the line, and then you put 2 units. This is going to prevent the formation of the inverted V. Eyebrows. Lift your eyebrows up. So you see, if we do not put Botox over here, she's going to have weird looking eyebrows, and this is something we want to avoid. So we just go perpendicular to the mid-papillary line all the way up, and you put 2 units, and then relax, and then we're gonna put 2 units, and make sure when you inject, make sure you're 2 centimeters above the orbital rim. So this is the orbital rim, the upper orbital rim, and this is where you have to inject. Raise your eyebrows up, and then I usually put 3 units in the middle, and that's it for the Botox. So for the wrinkles around the eyes, so I usually stand on the other side. I ask her to smile, relax. So you feel the bone, and you have to be 1.5 centimeters away, and you always inject away from the eye. I put 4 here, and then I'm gonna ask her to turn the head, smile, relax, and then we're gonna put 4 units over here. So that's it. So the way I did the Botox, because I want her to lift her medial eyebrow, so I did not put Botox in the middle part, and I want her to have a nice lateral eyebrow lift. That's why I did avoid putting Botox on the lateral sides. So for the chin, we usually just do 1 injection in the center, and you put three units, or you can actually, in some cases, you can do 2 injections, 2 and 2. So you put the midline, half a centimeter from each, from the midline to both sides, and you put 2 units from each side. And this is what we're gonna do. All right. So I'm just gonna get more Botox.
Yeah.
Yeah.
You want me to hold that end for you? Oh, you got it.
All right. So we go relax your chin, and then we go perpendicular, and we put 2 units on each side because she has, and you go all the way down, so you have to be on the muscle. All right, and you just massage it, and that's it.
That's it.
All right, so we did the forehead, we did the glabella, we did the crow's feet, and we did the chin. So that's it for now. We have to wait up to 10 days to do the touch up, and we'll definitely show you the pictures when she comes back for a touch up. Thank you for accepting to be in this video. You're already very good looking, so I don't know what's gonna happen after the Botox. All right, thank you.